Dear all, my name is Petya Nikolova and I am a member of Alzheimer Bulgaria Association. I am glad to present you the results of a research regarding influence of the obligatory quarantine related to COVID-19 pandemic on caregivers of people with dementia. The study was conducted among Bulgarian population and I work on it with my colleague and mentor Ivo Popivanov. It was focused on caregivers of people with dementia who were especially vulnerable in the condition of quarantine because of the spread of COVID-19. Caregivers who are facing many challenges in this situation, however, because of the stigmatization of dementia, ignorance, or other social cultural factors in Bulgaria. And in addition, it was lack of necessary support to this social group. The main aim of the study was to describe how the perceived stress, depression, caregiver burden, and self-esteem were changing during the condition of forced quarantine. There was also a comparison with the matching control group. The research design of this study was correlational and quasi-experimental type. All the respondents filled a questionnaire with general demographic data, a questionnaire for perceived stress, and in the context of COVID-19 pandemic, then Rosenberg self-esteem scale. After that, back depression inventory. And for those who were taking care of a person with dementia, they filled a short version of Zared burden interview. The participants of this study used an online link for the platform Google Forms. They filled the information consent form as well. The collected data was received for 5 weeks in the period of April-May 2020. During this period in Bulgaria was the first lockdown and the subsequent a bit less restricted pandemic situation. The amount of the participants at the study was 115. They self-evaluated themselves. The sex distribution of the participants was as follows: 26 men, 85 women, and 4 people who didn't indicate their gender. The responders' age was between 18 and 76 years old. They were separated in 2 groups: dementia caregivers, 48 people, and non-caregivers, 67 people. Let me tell you more about the results. According to the expectations, caregivers showed higher levels of perceived stress and depression, as well as tendency of lower self-esteem compared to the participants of the control group. Correlation analysis confirmed the results from previous studies in other countries, showing a relationship between high level of burden, depression, perceived stress, and low self-esteem. Moreover, some demographic factors were found to influence those levels too. For example, higher age of caregivers, as well as the fact that they live with a person with dementia, could be related to higher levels of depression. On the other hand, the number of people who are taking care of a person with dementia influence the burden and depression rating. Finally, the levels of burden and perceived stress were higher during the initial and late stages of dementia in comparison to middle stages. In conclusion, our data showed reduced quality of life in caregivers of people with dementia. It also shows how important it is to support such a vulnerable group of the society in extreme conditions such as quarantine due to spread of COVID-19. Thank you for your attention. If you have any questions or comments regarding the study, I'm available on the chat. Please contact me or my colleague Ivo Popivanov via email for further questions. All the best and see you soon in person.